Okay, May, before you head home today, just want to take a few minutes to talk about your treatment plan and go over everything, make sure you're comfortable with everything before you leave. Like you said, the hospital prescribed you lithium to kind of get you over the manic hump of what's been going on, and it seems like you're doing really well on it. You told me that you're taking lithium controlled release 900 milligrams once a day, 7 p.m. with dinner, so right around bedtime, which is good. Like I said, it seems like you're doing really well on it. If it wasn't discussed enough what lithium is, it's a mood stabilizer, which is designed to basically cut any too high or too low. So like with the manic, you're too high, and with the other end of bipolar, you're too low. So which kind of fits into where you're at. So it seems like you're kind of in the bipolar 1 range, and lithium has been doing well for you. Because of that, I don't see any reason to change the dose you're on or when you're taking it. Lithium is tolerated better in the evening, which you're already doing. Once a day is better because studies show that if you take it twice a day or more than that, it has a higher increased risk for damage on your kidneys. So if it's not broke, don't fix it. So we're going to keep you there if you're tolerating it well, you know. If you miss a dose, don't double it. If you have any questions about that, just let me know. And yeah, so one of the other things is lithium requires routine laboratory monitoring, which can be annoying to some patients, but I think in your case, the benefit will far outweigh the inconvenience of doing routine lab monitoring. However, just so you're aware, we have to monitor your lithium level. You're at the lower therapeutic end, which is great. It's a narrow range of 0.6 to 1.2, and since you're at a therapeutic level and you're doing well, even at the lower end, we don't have to increase it because the higher you go, even if it's still therapeutic, you have a higher risk for lithium toxicity, so we're not even going to mess with that. But we do need to monitor it, as well as your thyroid functioning, because sometimes it can cause issues with the thyroid. And because you were assigned female at birth, we still do need to do a pregnancy test. Also, if you ever become pregnant or you're planning on becoming pregnant, please let me know right away so we can discuss more of the risks and benefits of what that means, because lithium is teratogenic, which is a fancy way of saying it's harmful to the baby. It increases risk for cardiac issues, like one of them is called Epstein's anomaly, so which is around a 2 to 3 times higher chance than patients not taking lithium. So that's something we want to avoid for sure if you are planning on becoming pregnant. So we can talk about that in the future, but we'll have to do a pregnancy test. Let's see, like all medications, lithium has some side effects. Some of the more common ones are increased thirst, increased urination. You're taking it closer to bedtime, which is a good way to mitigate that. Sometimes there is fine hand tremors and weight gain, but a lot of these improve as you're taking the medicine. One thing that we really need to be careful of with lithium, though, is lithium toxicity. And if you have any of these symptoms, I want you to let me know right away, which include significant nausea, vomiting, severe diarrhea, difficulty walking or maintaining your balance, confusion, or muscle weakness. If you have that, I want you to stop taking the medicine and seek medical care immediately. There's also some drug interactions I want you to be aware of. Before you start any new prescription or take anything over the counter, I just want you to consult with me or a pharmacist first, but just some of the ones to be aware of are common ones like ibuprofen, naproxen, and other NSAIDs, because that can decrease how well your kidneys filter. And because lithium is unique and it is primarily excreted by the kidneys, we don't want you taking anything that is going to lower your kidney function, or else you're going to bring that narrow window closer to toxic, and you could have some very unpleasant or life-threatening symptoms. So we want to avoid that as much as possible. The other ones are thiazide diuretics. So if you ever are prescribed a diuretic, that can do the same thing, where your kidneys want to make up for all the sodium and water that your body is losing, so it's going to hang on to salt, which includes lithium, because that's what lithium is, and that can raise your lithium level as well. Other ones are ACE inhibitors and ARBs like lisinopril and losartan. They kind of work in the same way, which is where your kidneys try to compensate from the the angiotensin converting enzyme what it does to salt and water, and so it retains salt and also increases your lithium level. So those are just a few to be aware of. However, as a rule of thumb, and just so we're safe, before you take anything, let me or a pharmacist know. And if you have any other questions, don't hesitate to ask. Thank you. Okay, May, after talking through everything today, I think that we can go ahead and switch your lithium to Depakote extended release, also known as Divalproex sodium. It's great that your lithium has been working to stabilize your mood and prevent another manic episode. However, I can totally appreciate that certain side effects are just, you can't tolerate, like the acne and the hand tremor. So yeah, there's other medicines that are designed to help with what you're going through. So we'll try this one, which is technically classified as an anticonvulsant. However, it's also used as a mood stabilizer for bipolar 1. It's FDA approved for the treatment of acute manic and mixed episodes associated with bipolar 1 disorder. And although it wasn't originally intended as a psychiatric medicine, it works well. And part of the way it works, it's different than lithium. It helps by increasing the activity of the calming neurotransmitter GABA, which is why it's especially helpful in preventing further manic episodes. So we'll try you on this, and we'll see how it goes. And while we do this, we're going to gradually transition you from the lithium to the Depakote rather than stopping one outright. So you'll start by taking Depakote extended release 500 milligrams by mouth at bedtime, and then for 1 week, and then we'll increase it to 1,000 milligrams at bedtime for 1 week, and then finally increase it to 1,500 milligrams at bedtime. So we'll do it that way. And Depakote, like lithium, also requires lab monitoring. We're going to need to do a complete blood count, liver function test, pregnancy test, and we'll also check your Depakote level itself because it has its own sort of therapeutic range. The pregnancy test, it's like lithium. If you're planning to become pregnant or are pregnant, let me know because it's teratogenic. Once again, this one carries more of a risk for neural tube defects like spina bifida. So that's, once again, something we can discuss the risks and benefits of if, that becomes a thing. Like all medicines, Depakote can cause some side effects. Some of the common ones are nausea, stomach upset, dizziness, weight gain, tremor. One of the more unique things with Depakote is some people can notice that their hair is thinning or they lose hair. So if that happens, let me know. It is not necessarily an extremely uncommon side effect, but, we hope it doesn't happen to you. There's also some serious side effects that I want you to be aware of and let me know immediately if they occur. Depakote can cause it, but it's rare, but it can cause extreme liver damage. So if you notice yellowing of your skin or your eyes, that's something I want to know about right away. If you have severe fatigue, persistent nausea, vomiting, or pain in your abdomen, I want to know because it can also cause pancreatitis. And if you notice any bruising or bleeding, frequent infections, I want to know about that as well because another rare side effect of Depakote is it can cause issues with your blood cells. So just let me know if you have any of that. There's also several important medication interactions to remember with Depakote. One of the biggest is with Lamictal or lamotrigine because Depakote slows the breakdown of lamotrigine in the liver, which can cause lamotrigine levels to increase and increase the risk of a serious reaction called Stevens-Johnson syndrome, which is like a severe rash type of reaction. So it's something we have to be aware of. Aspirin, very common, can also increase the amount of active Depakote in your body. You want to be careful drinking alcohol when you're on Depakote because it can increase the CNS depressant effects. So I'd recommend, just limiting alcohol or avoiding it altogether while taking this medication if possible. Once again, before starting any new prescriptions, let me know, and we can just be safer that way and discuss anything. You're on a contraceptive right now, and or on a birth control medication, and this can lower the efficacy of that. So you might want to consider using other reliable contraceptive in the meantime while you're taking Depakote. But overall, I think this is a good change. This is a reasonable change in medicine. If you have any questions, just let me know. All right, May. After talking through everything today, I think switching you from Depakote to Tegretol extended release, also known as carbamazepine, is probably the next best step. The good news is, since you've been switching and taking these different meds, you've been stable with your mental health, which is awesome. However, once again, the side effects can be a deal breaker, which I understand. Depakote does carry that somewhat common risk of hair loss, which I know can be an unacceptable side effect for a lot of people, including myself. So totally understand. We'll move on to the next best thing. So we'll do Tegretol, which, like Depakote, is an anticonvulsant, but it also functions as a mood stabilizer. It's FDA approved for acute mania, a mixed episode. Not FDA approved for long-term maintenance, but it can be effective for that. It works a little differently than lithium and Depakote, because what it does is it blocks voltage-gated sodium channels, which helps calm the overactive electrical activity in the brain, which is helpful, especially in cases of manic episodes. So what we'll do is we'll gradually taper you off the Depakote, and then we'll cross taper to the Tegretol. So what we'll do is once you're done with the transition, we'll get you to Tegretol extended release 400 milligrams by mouth twice a day. And before starting Tegretol, like the other ones, we have some baseline labs that we have to do, including a complete blood count, liver function test, pregnancy test, because this one is also teratogenic. And we will also include, because of your Japanese ancestry, something called, we're going to screen you for the HLA-B 1502 genetic marker, and this is a very important test because people with this gene have a higher risk of developing a serious skin reaction called Stevens-Johnson syndrome when taking Tegretol. So, but we'll also continue to monitor your blood counts and your liver function periodically as we're treating you with Tegretol. Most people do tolerate this medicine well. However, there's some common side effects like the other ones. This one includes can cause nausea, drowsiness, double vision, sometimes balance and coordination issues. There are several serious side effects that I want to know about if you develop them, like a rash, especially one that's accompanied by blistering, peeling skin, mouth sores, or fever, because that can be a sign of the Stevens-Johnson syndrome. I also want you to contact me right away if you develop a persistent sore throat, fever, frequent infections, because that can be an issue with decreased blood counts. And then also if you notice any yellowing of your skin, eyes, dark urine, or fatigue, I want to know, because that could be an issue with your liver. And then Tegretol can also increase the risk for suicidal thoughts. So if you're having any new or worsening depression or suicidal thoughts, let me know right away. Tegretol, it also comes with several important medication interactions, unlike Depakote, which has its own, but unlike Depakote, it affects metabolism differently. It's a strong CYP3A4 enzyme inducer, which means it can change how your liver breaks down different medicines. And one of the most important examples is the birth control that you take. Tegretol can cause that to be less effective, and because of that, I'd recommend alternative form of contraceptive while you're on this medicine. Also avoid grapefruit juice, because that can increase your Tegretol levels significantly. Alcohol can increase your central nervous system depressant effects, so try to limit or avoid alcohol when taking this if you can. And then once again, as a rule of thumb, before taking any new prescriptions or over-the-counter meds, just let me know or discuss with me or a pharmacist first, because it can interact with a lot of different medicines. And then one more time, just to briefly discuss pregnancy. If you're planning to become pregnant or think you might be pregnant, contact me, because of the risk of serious birth defects. We can discuss the risks and benefits and the safest treatment plan. So I know we've made a lot of changes over the past several visits. You've been a trooper. If you do have any questions that come up, please let me know.